Welcome. I'm Gary Bebow, CEO of WRHS Health System, and this is my April CEO Connection. The standard of the month for April is prompt response. You know, oftentimes when we think about prompt response, we normally associate that with call lights, response to call lights. And boy, that's really important. You know, when you're not feeling well or if you're in pain, you know, the time goes by so slowly. And so the importance of prompt response as it pertains to call lights is really important, one that really deserves our attention this month. But you know, another prompt response, a way to look at it is how timely and how respectful are we and courteous are we to others who are waiting for us to respond to them, whether that's through responses through emails or telephone calls or showing up in meetings on times or all those things. So during this month of April, pay particularly close attention to prompt response, whether it's in call lights or whether it's just our relationships with others. You know, that's really a great standard for us to pay attention to. For the past several months, we've been renovating the east side of the Medical Arts Building to prepare a new location for our pain management services. You know, over the years, pain management has become a very vibrant, growing part of the hospital services. And with this new location, well, it'll be growing in space and better able to take care of patients in a very amenable, good environment. And so once it's completed, should be completed in early April, and once it's completed, we'll do some open houses and invite people over to see this new service. Dr. Siddiqui and staff are really looking forward to this new location. And so we're going to want you all over there, and so you can help us tell others about it. Along those lines of pain management, we have two new pain management physicians joining the crew over there. One is Dr. Carol McCourt, who will be starting in April, and another one is Dr. Robert Baker, who will be starting in May. So along with Dr. Siddiqui and Dr. Larson, we're going to have two new pain management physicians on board that will really do a great job in providing that service, even to Batesville and the larger service area of WRHS Health System. Another physician who will be joining us in May is Dr. Ethan Stoy. You know, ever since Dr. Kaiser Khan left our services back in September of 2013, you know, we've really needed to recruit another interventional cardiologist, and so along with the cooperation of Drs. Van Grau and Sanford and Kirkendall and Boyke and Dr. Hill, we are really fortunate to have Dr. Stoy joining us in May. So once he gets started here, I know everybody will be seeing him around, and we'll really want to welcome him to the staff. By now, I know you've heard about the favorable vote that we had in Sharp County. You know, by a 3-to-1 margin, voters of Sharp County decided against the funding of a sales tax that would build a 19-bed hospital. You know, obviously, we have made a major investment over the years in Sharp County, and so we're pleased that the county supported us in what we're trying to accomplish up there. You know, emergency room, satellite emergency room renovation project is underway right now, and everything's going as planned. So we anticipate sometime in early summer we'll have that project completed, and we'll actually start providing satellite emergency department services to that part of Sharp County. You know, what's a little bit unable to predict is just what it will require in terms of the state approval of the satellite emergency department. You know, ours will be the first one in the state of Arkansas, and so some of the things that we're going to be going through in terms of state approval, I mean, really there's no precedent. So, but it is our plan to have that up and running by early summer, and we'll be just keeping you updated as that time approaches. National Healthcare Volunteer Week is going to be celebrated during the week of April 6th to the 12th. You know, in our healthcare system, we have almost 200 volunteers who really provide a great service to us and our patients. You know, they do things that we just frankly don't have the time to do ourselves. And, you know, they're great ambassadors to our community. You know, so when you see those volunteers over this next few weeks, man, take a second and show them or express to them your appreciation for all they do. They really do make our health system a better place. So recognize them and give them a pat on the back. This concludes my April CEO Connection. I appreciate all the hard work you're doing. During this month, be sure to pay close attention to prompt response and continue to help us become a better hospital and better healthcare system.